Good evening. I want to thank everyone for joining us on this very special Monday night. And I want to welcome you to OrthoFi's Industry Expert Series webinar. I'm your host, Marla Merritt. And tonight we have a very special guest, Michelle Shimmin, founder and president of Shimmin Consulting. For those of you who are joining one of our webinars for the first time, the format is that we bring in some of the industry's most trusted experts, and we just spend an hour learning from them. As we determine the content for this year's webinar series, we decided to focus on areas where practice growth is often needed. Some of the changes we're going to discuss throughout our Industry Expert Series in 2024 may make you a little bit uncomfortable. We're asking you to consider a new way of thinking or a new way of working, or maybe a new way of supporting your team. But I hope you will join us throughout this year as we all take this journey together to get uncomfortable. And tonight will be no different as Michelle talks to us about digital solutions and managing patient expectations. Throughout this webinar, you will be able to submit questions, and I want you to use the Q&A box. So not the chat, but the Q&A. We're going to be gathering those questions throughout Michelle's presentation, and we will present them to her at the end and have just kind of a live Q&A, which is super cool to have Michelle, getting to answer your questions live. So let's get on to the content and what you've been waiting for. Let me tell you a little bit about Michelle. Michelle Shimmin is an international lecturer and trainer and also a consultant who has been in the field of orthodontics since 1990, working as a registered dental assistant and also teaching orthodontic assisting, marketing, financials, treatment coordinating, and practice management. Michelle travels the country and helps transform orthodontic offices on their systems to promote training, growth, and success through a comprehensive practices approach. Michelle is also one of the most sought-after trainers with many lecture events every year, both domestic and international. And I've had the privilege of hearing her speak many times. Each time I walk away with new learnings, and I'm sure tonight will be no different. Most recently, I've also had the privilege of becoming friends with Michelle, and her passion for life and for her team is contagious. So I know that we are in for a real treat tonight. Michelle, welcome, and we can't wait to learn from you.
Thank you. Thank you. Can you hear me okay?
We can hear you just great, and I can see your screen as well. So
excellent.
I will let you have it.
I really appreciate that introduction, Marla, and I just want to take this moment to thank you and Bergen and the team at OrthoFi and OrthoBank for just the opportunity to be able to support and participate in these excellent webinar series. So I'm thrilled to be here with you today, this evening, this Monday evening. Some of you on the East Coast, it's 8 p.m. For me out on the Pacific Coast, it's only 5 p.m. But I hope everybody had a great start to their week. I want you just to take a moment as we get present for this hour together this evening. And I want you to think about what you're going to do when you get off this tonight and when you're going to take some time to relax. If it's anything like me, I'm going to be grabbing a glass of wine and having a seat on my couch to get comfortable and cozy and relax. But I wanted to say our couch is where we're comfortable. And so tonight, I really want to challenge us to get uncomfortable, like Marla talked about. The philosophies that I'm going to talk with you tonight, I hope challenge you to really embrace getting uncomfortable, because that's where we grow. So let's stay tuned. This is really the recipe to elevate not only you professionally, but your entire practice and your team. So I really created this content to provide you with a comprehensive understanding of leadership skills, financial implications, patient expectations, staffing challenges, everything that's really related to the strategic integration of digital solutions in your practice. It aims to equip you with the knowledge and the tools necessary to navigate the evolving landscape and for you to be able to capitalize on the opportunities for profitability and growth. When we talk about digital solutions and OrthoFi, OrthoBank, we're not talking about a company or a service. I'm here tonight to talk to you about how to elevate your patient experience and how your patient expectations have evolved and changed, and how they're not going backwards after that evolution. So I'm really looking forward to this evening with you. So please, as Marla said, don't hesitate to put your questions into the chat box, and we'll see if I can get my slide deck to forward. So the only financial interest I have in this content this evening is as an owner of Shimmin Consulting. Tonight, I hope to inspire you. I want to empower you as an educator and an influencer, a true leader, no matter the position that you have within your practice. I want you to be able to envision what our industry is doing right now and how we have the opportunity to not only make our lives easier, but better, and to also serve our patients the way that they now expect, that new standard of care. The field of orthodontics is constantly evolving with these new technologies, with treatment modalities, and what our patients' expectations are emerging and how those are changing. So really, for you to be able to stay competitive and relevant, and most importantly, profitable, you really don't have a choice but to embrace and adapt to these changes. This process requires effective leadership and management skills that have the ability to influence buy-in from your entire team. In an economy where staffing and what I call cautious consumerism is one of the largest practice struggles, it's imperative that you nail and master this process. And I'm going to give you the tools to do just that. The importance of digital solutions in today's orthodontic practice lies in your ability to truly transform and enhance the efficiency, the precision, and the patient experience. These technologies have revolutionized traditional orthodontic approaches. As Marla said, I've been in the industry since 1990 and have seen a tremendous change in how we serve our patients through our processes, through our products, and through the care that we provide. So let's take a deeper exploration, and I will explain why digital solutions are crucial in your practice today. When we look at digital solutions such as 3D imaging and treatment planning software, we recognize that it provides our doctors with a more comprehensive and accurate understanding of a patient's dental anatomy. It gives us precise treatment simulations that allow for meticulous planning, which reduces the margin for error in enhancing the overall effectiveness of orthodontic interventions. We know that digital tools facilitate clearer communication through improved diagnosis and patient interaction. This is done by orthodontists, by the entire team in the practice, and to our patients through visual aids and interactive treatment plans available. Advanced diagnostic imaging enables us as team members and our doctors to detect issues earlier and communicate treatment strategies more effectively to our patients, which in turn fosters better understanding and collaboration with our patients. Our new consumer is seeking collaborative solutions. They are not simply coming into an orthodontic office looking for something to be delivered at them. They are wanting to be a participant in it. And not only do our digital solutions and treatment planning and visual aids allow us to invite our patients and the consumer on this journey with us, but OrthoFi is a perfect example of that in the financial investment presentation as well. With digital solutions for convenience, for efficiency, truly from start to finish, and how we get our patients documentation ahead of time, how we can have all of the financial information to our patients and available ahead of time, and then how we can have an interactive process around the financial arrangements that work best for our patients. So really, it enhances the patient-centric experience. And I don't want you to overcomplicate what digital solutions are. That's really a buzz phrase that we're hearing often. However, it just simply means using technology to serve our patients better, and make our lives easier and faster. For example, digital technologies optimize time and resource utilization by automating many of our routine tasks, enabling doctors and us as team members to focus on more complex aspects of patient care or different areas of focus, such as marketing within our practice. Automated appointment reminders, digital workflow, virtual consultations all contribute to a more streamlined practice operation. Practices that embrace these digital solutions position themselves as leaders, forefronting the industry, appealing to tech-savvy patients and that demographic as well. So the adoption of cutting-edge technologies not only attracts new patients, but also contributes to the overall reputation and perceived quality of orthodontic care. The orthodontic landscape is continuously evolving, and staying current with these digital advancements ensures that your practice really remains competitive and aligned with industry trends and ever-changing patient expectations. Today is all about the components involved in these digital solutions and the implementation into your practice and your everyday processes. What's really important to consider and address with the entire team is the development and the impact of leadership skills for strategic integration of these digital solutions in your practice. We cannot overlook the importance of leadership in this process to facilitate and encourage success all around. So while assessing the financial implications and opportunities for profitability in our practice, I challenge you to really assess and understand the effectiveness of your leadership throughout your practice. Through our time today, we'll also identify and understand challenges in staffing within this changing orthodontic landscape and how these digital solutions really support and resolve this struggle in many ways. The definition of a leader, especially in an orthodontic practice, really refers to the ability of individuals within the team to guide, to inspire, and influence others effectively to achieve a common goal, foster a positive working environment, and deliver high-quality patient care. In the context of orthodontics, leadership also extends beyond the clinical expertise and involves a combination of interpersonal, organizational, and strategic skills. So let's talk about the breakdown of these key elements in the definition of leadership within your practice. You will not be as successful in integrating and implementing changes in processes and protocols or services to your patients if you don't have effective leadership that has the ability to influence the buy-in from your team members. Leaders in orthodontic teams are forward-thinking. They're able to envision the future of the practice, align that with the goals of the practice, and to what that changing and evolving landscape in our industry is doing. And they set clear direction for the team. They're visionary thinkers. They inspire others to work towards these common objectives, and they embrace innovation. Communication is a cornerstone of leadership in orthodontic practices. Effective communication and active listening. So leaders convey their vision and their expectations and goals clearly to the entire team, and they foster open communication channels throughout every position within the practice. They encourage dialogue and collaboration among team members. Each one of us as team members in a practice brings value and a skill set. So as leaders, we want to be able to maximize our teams, maximize their skills and minimize their weaknesses, maximize their strengths and minimize their weaknesses. We want to be able to recognize the value of a cohesive and collaborative team, because when we do that, we're able to build strong working relationships, and we are able to foster a positive and supportive team culture. I was doing a study earlier in the week, or last week, I guess, and I was coming across a study that states 82% of team members will leave a work environment due to poor management and poor leadership. And I felt that was a percentage that really resonated with me as we deal with a challenge in the workforce at this time in our practices. But when we talk about team building and collaboration, we want to recognize that orthodontic leaders recognize the value of a cohesive and collaborative team, and they understand the need to build strong working relationships among your team members. Leadership involves making informed decisions for the benefit of the practice and its patients. Leaders assess situations and weigh the options, making timely and effective decisions. Leaders are also proactive problem solvers. I like to add the word positive in there, positive, proactive problem solvers. I often say it does not matter the position you hold in the practice. Everybody has the ability to be a leader. Leaders lead by example and serve others outside of your position. I hope it starts with the doctor demonstrating that and what effective leadership is as well, with collaborative communication and clarity in our expectations, because combined, that delivers the highest level of accountability. But we also know that leaders in an orthodontic practice must adapt to change, especially in the face of technological advancements and shifts in what our patients' expectations are. Leaders guide the team through these transitions, ensuring that the changes are implemented smoothly and that everybody is equipped to embrace these new approaches and to be able to understand if we're successful at it. We're going to talk about standard operating procedures and how those tools can really support this process. But as I said a few slides ago, it starts with leadership. Effective leaders inspire and motivate their teams, and they will include a commitment to delivering patient-centered care. So truly, in essence, leadership in orthodontics is multifaceted. It's a skill set that combines strategic vision, effective communication, collaboration, adaptability, and a commitment to both team excellence and patient care. So strong orthodontic leaders play a pivotal role in shaping the success and the reputation of your practice, while contributing to the advancement of our profession as a whole as well. Leadership does play a pivotal role in implementing digital solutions within orthodontic practice. I'm going to change that with your practice. The adoption of digital technologies is not merely a technical change, but it's a transformative process that impacts your entire practice, your entire business, from the workflow efficiency to your patient care. Here are key reasons highlighting the importance of leadership in the successful integration of digital solutions is necessary. Passion, influence, and leading by example are key factors to what is truly needed in a strong leader. Because to succeed, you have to believe in something with such a passion that it becomes reality. This is a strong quote by a leader that resonates with me, because no matter the system, the modality or process, whatever you think or feel is what you will exude to your patients. As a practice advisor and coach, I often get hired to be brought into a practice to turn certain processes or systems around, or to accomplish a different result within that practice. And the first thing I do is I talk to all of the team members and I ask how they feel about that process or that product or service. Because I know no matter how those team members think and feel, that is what they will exude to the patients. So the practices that bring in a solution that they feel will truly serve their practice and their patients, but they're not successful at it, are the practices that have not focused on what it takes to get the entire team's buy-in and to really be able to influence and train our team, our entire team, as educators and influencers for our patients. Envision these sports teams. You know, most sports teams are run better than orthodontic offices because they have coaches, they train and they condition, they have playbooks, they have instructional playbooks on what's expected out of them. They know where the finish line is, and they know what's in it for them when they not only cross that finish line, but when they cross that finish line first. So I want us to envision what your team, what your practice looks like, or what it would look like as an athletic team or a sports team. These teams that I've put up here need to be synchronized and strategic, specific, and planned. Think about each person's responsibility on these teams. Take, for instance, the sport of crew. Each seat on the boat has a different role and a different expectation. They actually have to perform very differently. But think about if they didn't have that synchronization and that strategic, specific training plan that they've gone through. And one athlete puts the oar down too low or too fast, or their pace or their depth does not align with the other athletes in that boat. They absolutely will not be as synchronized and successful as they desire to be to cross that finish line first. So this has always been a really good word picture for me when I'm talking to practices about what we're looking for, and the fact that each person on your team has a different role and a different expectation. And we absolutely have to design it to where they understand that clarity, they understand their impact, because I'll tell you what, your practice's success does not start and stop with your treatment coordinator. We have to recognize that each point of contact with your patients is an opportunity for us to educate and to shine. And so let's talk about, as we implement more digital solutions within your practice, how we can open up opportunities for growth and profitability. I want you to just think for a moment, one, the solutions that you currently have within your practice, and two, what opportunities do you have to grow and expand those solutions? Whether we are talking about OrthoFi, treatment modalities, communication convenience, or virtual appointments, or remote monitoring for your patients. Train your patients, educate your patients on your services from that day one point of contact. Let your passion shine through. I wanted to just quickly review and go through a few of these opportunities that digital solutions provide for additional revenue channels and growth within your practice. But OrthoFi, for instance, is a proven solution to support increased conversion rates for your patients through something as easy as more flexible and convenient financial arrangements, and for patient ease to be able to make those decisions from the comfort of their own home. When we're coaching on the financial investment presentation, I love to educate our patients to be able to say, Dr. Orthodontist does not want finances to hinder a patient having an ideal smile. Therefore, we have options to fit into every budget. And this is where you get to be able to create the financial agreements that work best for you. And the patient has control over that, fitting into the bumpers of what you have created within your practice. So I really also want us to take a look at how can you shift your solutions to be more patient-centered and not practice-centered. This is a challenge that a lot of orthodontists face because this is your skill and your work, and there's nothing limited that you want to provide to this patient, but make sure that we're actively listening through the exam process to really hear what our patients are looking for. It is our responsibility to educate the patients on their malocclusion and on what your full recommendation would be for those solutions. However, if a patient is only wanting to correct their social 6 and have a more visually appealing smile, we want to be able to have those discussions with those patients and meet them where they're at as well. But we want to recognize that those additional revenue channels include online scheduling and virtual appointments, or to be able to also recognize that utilizing treatment simulation software enhances patient communication by visually demonstrating what expected outcomes are. Patients are more likely to commit to treatment plans when they have a clear understanding, leading to increased case acceptance and additional revenue for your practice, that growth that we're looking for. We also see that when we have those digital simulation, whether it's in the beginning of their treatment so that they can see what the potential final result will look like, or whether it's throughout treatment, please do not underestimate what our digital solutions in being able to show the patient mid-treatment where they came from and where they currently are, because that's where you can increase your patient's compliance because you're putting them in the moment right now, and they don't lose that enthusiasm to the changes that are happening throughout their treatment. When we implement a targeted digital marketing campaigns to reach a wider audience with effective online marketing that attracts new patients, boosts practice visibility, and ultimately contributes to increased revenue and growth in your practice. Or patient education portals are another way that we can inform patients about everything that we can provide and what they'll experience with our practice, and recognize that they're more likely to pursue comprehensive treatment plans, resulting in that increased revenue and growth for your practice. Digital solutions that automate patient communication and follow-up processes improve patient retention. And regular communication and reminders encourage patients to continue treatment, leading to that sustained revenue as well. Another area that we see improvement on is our patient experience, which generates additional referrals within your practice. So utilizing digital communication channels such as emails and secure messaging platforms to enhance this communication provides clear and timely communication, which fosters stronger patient relationships, encouraging increased, stronger word-of-mouth referrals. We want to also develop patient portals where patients can access their treatment plans and their progress updates, educational materials, which empowers patients to be able to promote this engagement and their satisfaction with you. Of course, we have post-treatment engagement, the same exact way that I just gave you an example with as well. But through our online reviews, we have a way with our cell phones and something as easy as a scanned QR code to be able to increase your referrals and leave online reviews for your patients in a way that is easy and efficient and effective for your patients. Our patients are looking for that ease and that convenience. Let's talk about additional ways that we can really leverage technology for your practice growth. Each physician in the practice should at this point look at and assess where the practice can grow. I hope that after our night tonight, each person, no matter the position you have within the practice, feels inspired and vested for the impact that you have. And I challenge you to really assess and look at where your practice is as we go into the 6th month of 2024. Where do you, within your position, have the ability to contribute to practice growth? It's imperative that we look at data analytics for this performance insights. Utilize data analytics tools to gain insights into your practice's performance and your performance as a team member. Look at patient demographics and treatment outcomes. By strategically implementing these digital solutions, your practice can not only enhance your operational efficiency, but it can also foster this growth in revenue, patient experience, brand visibility, and truly overall practice success. You should always make a decision based on data and metrics, and not based on a feeling or a perception. I feel like we close all of our cases. I feel like we have really great delinquency. We don't have very many patients past due at all. Don't go off of a feeling or a perception. Go off of data and metrics. That's really important. You have to therefore realize that every position within the practice should understand their own KPIs or key performance indicators and what those results reflect, and make decisions accordingly. Team members, don't sit back and wait for the doctor or the office manager to tell you this or give you this report to manage, but be positively proactive in recognizing the opportunities that you have within your area of the practice to make an impact and to grow your practice. This makes you a more valuable team member, and it's also very personally fulfilling in what you know you can contribute to the success of the practice. When we talk about the shifting landscape of our patient expectations, I guarantee you, each of you have probably heard of how our patient expectations have shifted after COVID. We recognize what we all had to do and quickly adapt to be able to just care for our patients. But I'll tell you, your patients experienced a level of convenience and awareness to what's available to them through that time. And for us as practices to not have continued to make those changes and continue to grow in those solutions is actually a really we're doing a disservice to our patients. So we have to recognize that our patients now expect convenience and digital access to their healthcare services, including their orthodontic care. So providing this online access to meet the demand for this convenience and accessibility is imperative. Patients also have increasingly sought personalized and tailored treatment plans. Using digital technologies for these treatment simulations and interactive presentations will set your practice apart and meet your patients where they are and what they're looking for. Patients are also seeking transparent communication, not just one-way communication, but that interactive communication that I was speaking about. We're going to talk about further leadership in a few slides that will talk about active listening and what is required of you and what you can do with that to be more successful at your communication. But our patients want engagement in their decision-making. They want to be active participants in their healthcare decisions, including their orthodontic treatment. If they're parents, they want to be active participants around their child's care. So it's imperative that we incorporate shared decision-making approaches and tools that allow patients to actively engage in this decision-making process and understand the implications of their choices. So with the overview of the new standard of care, patients' desires are not going backwards. Traditional molds, for instance, have been replaced with digital impressions and 3D scanning techniques. Patients' expectations and what they're going to receive when they walk into your practice is not a goopy mold, but rather a very quick, efficient, convenient, and comfortable 3D digital scan. We understand that this improved precision in treatment planning also reduces our patients' discomfort, and it really supports our valuing their time. We recognize this with clear aligner therapy and not only with virtual appointments, which I haven't really seen tremendous, or I should say a huge amount of practices be tremendously successful at those virtual appointments. However, we are seeing tremendous success in virtual monitoring and communication with our patients. And I really hope that practices can see the importance through clear education and communication from every team member, how beneficial virtual appointments can be to our patients with that convenience, because we are giving enhanced accessibility in that convenience for your patients, really, especially in situations where in-person visits may be challenging. And if you want to sit at your front desk at 3:30 in the afternoon and just observe your scheduling coordinators or patient care coordinators attempting to fit in an orthodontic appointment, you'll see what that challenge and struggle is that our busy families face with so many of their commitments that they have with their kids and with themselves personally. When we talk about patients not going backwards, we also recognize that there is a loud, tremendous amount of information online in news articles about AI and what AI can do for our lives outside of orthodontics alone. And so when we can utilize what that highest level of technology is, and to be able to support our orthodontic care through that ability, we demonstrate to our patients faster and more precise treatment planning, leading to more improved outcomes, with patients' compliance increasing and with your price per visit tripling. So we find this through customized braces and 3D printed brackets, and we're going to go through what the digital workflow looks like, but digital workflow management systems really allow us to manage patient records, appointments, communication, really integrate it into our more modern orthodontic practices. And the impact is streamlined workflows because we have clearer expectations that deliver a higher level of accountability. We have reduced paperwork and truly improved overall practice efficiency. I love this example. I spent a lot of time in Hawaii. I'm either in Washington or Hawaii. It's a place that we enjoy. And I'm not in the water surfing with the surfers because I'm petrified of sharks, but I love to sit back and love to watch the surfers. And it's really interesting to me because there is a key point that the surfer has to start really paddling fast. And it's actually before that big wave gets to them. And if they don't do it soon enough, they're really going to miss that wave and they're not going to be able to be successful in riding it all the way into shore. And so I really liked, I don't know that because I'm not a surfer, I don't know when that is, but I truly enjoy watching it out in the ocean and watching the technique of these surfers. And this really is an analogy that resonates with me as well, because if you think about the wave of change and the change that our industry has experienced in the last 5 years, especially, there are those practices that really understood how they needed to be ahead of that curve of adoption so that they can truly maximize what that is. And there are those practices that waited too long and they waited for that wave to pass them by. And I challenge you tonight to be those practices that recognize the value of these digital solutions and what your patients' expectations have done, and to really be ahead of the curve of adoption in how you can serve your patients. But adapting to the evolving technological landscape in our industry can be challenging, and it involves staying informed about current trends, integrating these advanced tools and technologies, and embracing a mindset of continuous learning and growth. So by strategically incorporating these emerging technologies, you can enhance your patient care, improve efficiency, and position yourself really at the forefront of our industry. Every practice I know of is looking for something that they can use to set themselves apart from any other practice out there, to really set themselves apart to their patients so that they can truly receive more referrals, more word of mouth recognition, and have that unique competitive advantage. I wanted to give you this example of a roadmap in creating standard operating procedures, or the roadmap or the pathway, if you will, of a process. These visualizations are really important for your entire team. So I do highly recommend that you create these yourself. And I have a few other examples and a few other slides that I'll show you. And I'll share with you some programs that I use to create these for our clients. But this is really the foundation upon which we build out our processes. It creates this continuity within the practice as a whole. And every team member understands it, whether they're a part of that process or not, they understand what's happening, which is very important. So when we talk about implementation of SOPs or standard operating procedures, it's oftentimes where we observe practices getting hung up. The practice has a vision, a desire, they create the system maybe, and then they really get stuck up or caught up in how to make it happen. So remember, when you implement, you should always pivot when and where needed. Just because you create this roadmap or this workflow doesn't mean that this is the end of the journey. It's a fluid journey. It's a journey that we're able to implement and then assess and then to pivot or make adjustments as needed. But it's really the process of our growth, and it solidifies the systems within the practice so that there's instruction and there's guidance and clear expectations with every team member within the practice. Because really, every team member has the opportunity as an educator and an influencer within your practice to really own these opportunities and to have that passion to be able to influence what your patients think and feel about what you provide them. Whether it's OrthoFi, whether it's dental monitoring, whether it's Lightforce 3D printed brackets, there are reasons that your practice chooses these digital solutions to serve your patients and to serve your practice. And each team member should understand the why behind it. And each team member should really understand their impact in that education process to your patients. I often go into practices that will have a brochure or a flyer or marketing item out on the front desk, and I'll ask about it. And the team member at the front desk doesn't really understand their impact they have available as an educator. And they'll oftentimes just give a flippant response, or they'll say the treatment coordinator will talk to you all about that. But I want you to envision, especially if you are a patient care coordinator, I want you to envision the impact you have if you actually smile and stand up and really be able to say, let me tell you all about this, because you know what it is, you know what your workflow and process is with that mapping in your practice, and you know what it provides your patients. That is tremendous impact. I always say when I talk about influence, I talk about what it looks like when somebody is talking about a recent show that maybe they've binge watched. And when I'm on stage, I ask, the attendees, is there any show recently that you've been binge watched? And inevitably, a bunch of hands go up. If I were to be asked that question, I would say Yellowstone, and my face would light up and I would say, oh my gosh, I love this show. I've watched it, I've binged it twice. Like, it's a really great show for adults. But imagine if we have that same excitement and passion about what we provide our patients with our solutions. Everything from how they fill out their paperwork, to how they choose their financial arrangements, to how they communicate with our office, or how they schedule their appointments or pay their bills. All of those processes, you as a team member have influence over how the patients think and feel about it. So think about that, because I would expect that if you were binge watching a show that you loved and I asked you what that was, your face would light up and you would have the ability to influence a curiosity out of me with that. So here is an example actually of a digital workflow within a practice. I'm going to blow this up in a minute. I know you see it small, but I wanted you to see the extent of it. And the various colors represent the different team members and their role within this process and when. So take note, for instance, how many red circles are present on this particular workflow, which is a 12 months of Invisalign, and this is dental monitoring. This workflow does not solve your problems, but this is really the easy part in spelling it all out and giving essentially the clear instructions and expectations from your team members. Your team's buy-in and passion is where you find success in this process. As we expand and blow out what this digital workflow is, you'll see how each team member, because each color, the black is the TC, the blue is your patient care coordinator or scheduling coordinator, and the green is your digital lab manager. So each team member is color-coded and has a different responsibility at a different time. So this is where we create those roadmaps, those digital workflows, those clear expectations. These are some additional digital solutions available, and this is all in how you can also serve your referring professional partners in creating a treatment team on behalf of your mutual patients. How are we going to use technology to truly make our processes efficient and convenient, not only for our practice and our patient, but also for our referring partners, professional partners? I'm going to give this roadmap to you again. I wanted you to visualize after I gave a few other examples. But again, this is an example of a digital roadmap. If you want to notate Lucid, L-U-C-I-D, Lucid is a program that my team and I use a lot to create these different types of workflows. We look to see what is enticing to the team and visually what they connect with, and then we create those for them. I challenge you to look at where you have the opportunity to provide better clarity in these systems within your practice as well. Again, this is the foundation upon which you'll build. This creates continuity within the practice to set the team up to be as successful as possible. I say this all the time, the most expensive words in business are "we've always done it that way." And I will say, typically the most senior team members are the team members that say this to us the most. And this is not reflective of understanding how our industry is changing so quickly. So I hope to influence and inspire a desire to understand the value of being open to this change and understanding what this changing landscape is doing to our industry and how we can have impact over it. So we know that we've got to understand and recognize the changing landscape with these digital solutions and what our patient expectations are doing. And we also need to understand how this can potentially disrupt our current workflow, but really be strategic ahead of time about it, and how this can really provide a patient-centric approach to our solutions and our orthodontic care for our patients. I do want to share with you a few areas that are really important in assessing and looking for team members that have these abilities. This is where we find the greatest level of success in being able to grow and adapt our business to those ever-changing needs within our industry. But we do want to be able to have a skills assessment, conduct a comprehensive assessment of our team members' current skills, and identify where there's any gaps in technical skills or digital literacy or communication or patient engagement skills, and really be able to create and provide a strategic, proactive solution to combat that. We want to assess our team's proficiency in utilizing digital technology and tools, the management software, and any other technological advancements that you are choosing to incorporate within your practice, and develop the training programs to enhance what that digital literacy, ensuring that our team members are comfortable using these technologies so that we're arming them and setting them up to be very successful. Communication skills is extremely important, not only internally among your team members, but also with your team members to your patients as well. So especially when we're talking about a patient-centric approach, it's not a matter of just being yes people and saying yes to all of our patients' needs and demands, but it's rather having the ability to be able to influence the direction of the conversation and the outcome, and how the patient ultimately thinks and feels about the conversation and what we provide to them. So communication training is important to be able to enhance these patient interactions, managing our patient expectations, and really to be able to educate and convey of the benefits of these technological advancements and solutions that we provide to our patients. I have talked about adaptability and change that is needed around this, and I'm sure every attendee on this evening has faced frustrations around the need to adapt and to change to serve our patients in the last 5 years. It can be frustrating, it can be challenging if we're reactive to that. And we experience this and see this really after a big event like the AAO, or if you've gone to your software meeting and you come back and you get all excited, or your doctor, your office manager, or TC get all excited about bringing something new into the practice, and they just throw it at the team. And that is not where we facilitate success out of our team members or out of that process or that service that we're providing. So implement change management training to help your team navigate these shifts in technology, in workflow, and in our patient care approach. And then also when we look at the culture of our team and the understanding and commitment that we're looking for in that culture, because remember, the culture in your team is completely 150% reflected to your patients. So we want to understand that, yes, we have a very diverse patient population, and we want to ensure that our team is culturally competent and understands what our commitment is to that. We do this through team collaboration and cross-training as well. We implement cross-training programs to ensure that your team members can support each other across various tasks, yes. This does foster a more flexible workforce and work environment. However, I caution you not to minimize or avoid accountability in that cross-training. Cross-training can oftentimes produce a finger-pointing culture. And so it's really important that in your cross-training, you still have clarity and expectations of who, what, when, where, and how. And then we can have that support in other team members through that cross-training, which is really effective. By addressing the staffing challenges, identifying skill gaps, and implementing effective strategies for teams' engagement and adaptation, your practice can build a resilient and highly skilled team capable of navigating this ever-changing landscape in our orthodontic industry and what the expectations of the new standard of care that our patients desire and expect right now. This is some tools that I wanted to provide to you for increasing staff engagement. When I talk about clear communication, we want to ensure that transparent communication among all the team members. This week, I was coaching a really small team with only a handful of team members, and there was so much frustration that somebody said something to one person or the doctor told somebody but didn't pass to everybody, and it was really in every area of the practice, down to what marketing efforts were going to be done in the community and when somebody was out doing it, nobody else knew what was happening. So it really sounds like minutia, but it is probably one of the first things that can tear down the culture within your practice and create team members that are not vested in not only their role in the practice, but in the growth and the success of the practice. It really facilitates that clock in, clock out mentality. So we also want to create, as we talk about with our patients, but create an interactive, inclusive, collaborative format around decision-making, appropriate decision-making within the practice that is related to these changes in technology and workflow and patient engagement strategies, because that's where you get the greatest buy-in from your team members. And you will not be successful if your team members or if you as a team member don't have that buy-in. We really want to see the benefit of empowering team members, increasing their ownership of their role, and to encourage a collaborative approach to that adaptation. So we can do that through our training and the development, the commitment that we have around that. Don't underestimate what team meetings, structured team meetings that you have all team members contributing to. I never want to facilitate a team meeting where you have one person standing up and talking at the team the whole time, every time. But every person should have a part to report on and interact with and to collaborate with, because this enhances your team's competencies, your personal competencies. It boosts team's confidence and ensures the team remains adaptable to these evolving requirements as well. So as we get ready to wrap this up, I want to encourage regular and consistent feedback and check-ins with your team members around this change, and flexibility, understanding that these changes are going to be fluid and we have to assess and adapt and make the necessary changes, and then always be able to celebrate successes and milestones. Reinforce positive culture among your team members. Motivate your team, foster that sense of accomplishment, because that's what your team will really strive to continue to grow and improve throughout their process. I hope this evening I created an inspiration and that I was really able to influence you to understand what our industry is doing right now and how our patient expectations are not going backwards. They actually are increasing in their level of education and awareness. And so I want you to feel armed with the tools to be very successful. I hope you feel motivated, inspired, and energized to get uncomfortable, to grow, improve, and succeed. At this time, I wanted to take the opportunity for each of you to spend your Monday evening here with me and the team at OrthoFi and OrthoBank. And again, Marla, for everything that she did to put this together with her team behind her as well. So thank you all very much. I look forward to seeing you in person, hopefully sometime very soon.
Yeah, thank you, Michelle. That was awesome. And we do have a few questions. So
Excellent.
we've got about 5 minutes left, and I'd love to get some questions in front of you. So there was one question about interested in opening a de novo practice, and all the technology that you spoke about can add up quickly in terms of cost. So with minimal to no new patients in a new practice, does it make sense to invest in technology early in a practice like that?
Great question. So yes, obviously the revenue available in starting a new practice and building that practice is going to provide a limitation. So what I always recommend is to be able to essentially set your goal and work backwards to how you're going to be able to get there, and start slowly. Start slowly as you can and you're able to, but set a culture of expectation that you see the value in these digital solutions, and that's the way that you will go. So start out with digital communication with your patients that you can. Start out with the technology within your practice that you need, such as your scanners and your, to be able to provide that as well from the beginning. And we find those practices, when you're looking to decide what to invest in, if you can really understand where you're going to get the greatest impact to your patients, and based on what your end goal is for what you want your practice to be, you're going to have less and less correction and redoing and redirection later on, which is what we see a lot in practices.
Love that. Love that. Okay, so there is a question about training. So what training do you suggest for team members who need to grow in like digital literacy? Is this something each practice should develop internally, or are there resources that you would recommend?
The answer is both. Yes, internally, you have to set the culture that we're all going to be committed to this. There is never a self-actualization of I'm digitally literate. That we're always growing and learning as digital solutions and technology changes and grows. So that should be the expectation within your practice. Yes, together, our teams in what you have internally right now, or regarding the digital technology, our teams should be working together and supporting each other and elevating every person's skill set. I often find that, oh, that person doesn't work real well with that and doesn't like that and doesn't do that. So we just enable them to stay in that place. That is not setting a culture of adaptability and growth. We want to commit to giving those individuals the tools that they need, but also recognize if maybe that isn't, if our practice is going in this direction and not you're a person that's not willing to change and grow and learn, maybe they're not on the same train as your practice is on right now. Also, so much for, I mean, Marlo, you guys have so many solutions available to be able to make it as easy as possible to learn and understand through these webinars. There is so much availability out there online and through companies such as yours that is available to team members, and just reach out and ask for them. There's so many webinars, so many different recorded sessions or playbooks that are provided as well. Email me, I'll provide you any recommendations I can as well. But yes, there are a lot of resources out there.
So I loved pretty early on in the webinar, you used the description of the crew team and everybody rowing together. I just watched the movie, The Boys in the Boat. Have you seen that?
Oh yeah.
It was awesome. So it made me think about that. I was on a plane coming home from Denver this past week, and I watched that movie. And so I was glad to see that example. And then I also, so I was sitting there thinking as that slide came up, are there certain roles, and you actually showed a slide later with the colored bubbles of what each person should own. Does that vary from practice to practice, or do you typically find that a treatment coordinator, these are the things that role needs to do, or does it end
Yes.
up?
I'm so glad you
Kind of
asked
talk
that
to us about
question.
that.
Yeah. So first of all, I want to go back to The Boys in the Boat. That is, I love that show. My twin sister Rose and crew recreationally. I'm from Washington. I'm University of Washington alumni, and that's what school is all based on that. So that is just really a good connection to me and why I put that in there. But if you remember the part of the movie where they were watching every athlete during all the skills assessments and tests and on the boat and how they were performing, and they'd move them around, and they were truly ensuring, based on the individual athlete's skill set, that they were putting them in the right seat. So that's something that we should also look at within our practice. And in doing that, most of the time, especially when we have a collaborative conversation with our team members, we're able to recognize what they like and what they feel they're good at as well. And it's a win-win for everybody involved to ensure that we're maximizing their strengths and minimizing their weaknesses. Now, to go back to that workflow, we do recognize that there are typical guidelines within a treatment coordinator, within a scheduling coordinator, within a financial coordinator, yes. And that workflow is going to vary based on how big the team is, how big their digital solutions are in that workflow, how many people they need. Sometimes we'll see a digital manager and a lab manager be the same person, and sometimes we see them be two different people. So they would be separated out in that workflow. So there is definitely a level of customization needed with it, and to ensure that you do have the right people in the right seat.
Michelle's talked a lot about OrthoFi and how our digital solutions can help a practice. We would love to talk to you individually about that. If you'll use this code and just talk to us, get an overview of our services. And then if you do end up signing up because you were on this webinar, we're going to have some special deals for you on our implementation fee. So we'd love to talk to you about that and be able to give you that promo pricing. So that concludes our webinar. Michelle, this has been great. Thank you so much for joining us and spending time with us. And thank you to all our attendees. We hope to see you next time. And thank you very much.
Good evening.